CPAP, or continuous positive airway pressure, and BiPAP, or bi-level positive airway pressure, is used to maintain a consistent air pressure to keep the airway open and patent. It improves airflow and facilitates gas exchange by maintaining positive end expiratory pressure, or PEEP. CPAP gives a set respiratory pressure in inspiration and expiration. BiPAP adjusts the pressure as the patient is inhaling versus exhaling. In the pediatric population and on the BBI unit, the patients are most likely to need CPAP only while sleeping due to sleep apnea or neuromuscular disorders. It is typically implemented following a concerning sleep study. Kids who have these needs see a large benefit with consistent and appropriate use of their CPAP or BiPAP, including improved sleep quality, enhanced brain function, positive behavior and mood changes, and reduced risk of complications. On the BBI unit, it is typically the respiratory therapist and the parents' responsibility to ensure the settings are correct and that the machine is on and working appropriately. A parent should stay at the bedside while the child is on CPAP. The nurse needs to be aware of the general care and management to maintain patient safety. There are different kinds of machines, so familiarize yourself with the one that your patient has and make sure to know their settings. Some kids may have oxygen and others may not. In an emergency, you must be able to relay the necessary information and adjust while help is on the way. If your patient is nauseous or vomiting, there is a high aspiration risk. Make sure your patient is able to take off their mask if they think they may throw up, or have the parent ready to assist as needed. While the patient is inpatient, the nurse needs to ensure the patient maintains a seal with their mask. There are different types of masks, which may cover different parts of the patient's face. The straps need to be well secured and comfortable for the patient. Always be thinking about skin protection. Aim for a clean and dry face before putting on the mask, and watch for skin breakdown with your regular assessments. If needed, place Mepilex or another barrier between the mask and the skin. You can cut a Mepilex light to cover any of the areas of redness, but not covering the nares. Don't forget to double check where the straps may rub on the patient. Keep in mind that this is the patient's home machine and baseline, so talk with the parents and work together as a team to maintain their home routine as much as possible. On the BBI unit, the patient must be on home settings, have a non-respiratory diagnosis, and be overall stable. If at any point the patient's status is changing or you are concerned, coordinate your resources and call a pediatric rapid response if necessary. The patient needs to move to the PICU if they require increased settings or 6 settings, if they are admitted due to respiratory concerns, and if they have a high or increasing Pew score. Always use your nursing judgment to maintain patient safety. Your respiratory therapist is your main resource, so use them if you have any questions or concerns about the patient's home CPAP.